The COVID-19 pandemic has gone on longer than most of us could have anticipated. If you found yourself feeling stressed and overwhelmed due to these uncertain times, don't worry, you're not alone. It's completely normal to feel anxious, scared, sad, and even angry. But taking care of yourself can help you cope with stress. Even as more people are getting vaccinated, you need to continue with preventive measures to protect yourself and those around you. I'm Dr. Freddy Gomez. Welcome to MedTalk Health Talk on CNN Philippines. The best way to protect your loved ones from COVID-19 is to take care of yourself. More than a year into the pandemic, it's worth reviewing the tried and tested ways to keep healthy and the effective safety protocols you need to follow even after vaccination. Let's welcome our guest for today. With us is Dr. Candice Brillante Corpus. She's a pediatrician and consultant at the Asian Hospital and Medical Center. Also with us is Dr. Ray Christopher Obiña, a certified family physician and vice president of the Philippine Academy of Family Physicians. Thank you both for joining us here on the program. Now, personal care usually involves creating meaningful lifestyle habits like eating healthy and exercising. But during a pandemic, these simple habits are even more crucial. I'll start first with Dr. Ray. What do you think we need to do in order to stay physically healthy?
In this time of pandemic, we have to boost our immune system. So we have to eat the right food and we have to do some physical activities. And at the same time, we have to have adequate rest and sleep.
But admittedly, COVID-19 and the social distancing protocols have posed a challenge for a lot of people. Dr. Ray, can you give us some tips on how to be more efficient in keeping our physical health in check?
Yes, so we don't need to go out in order for us to have some physical activities because at our very own houses or homes, we could be able to do some household chores. And by just doing household chores and just by walking, we could burn some calories to around 200 maybe. And if, for example, others would have a backyard garden, and then probably you could plant and that would burn you some 200 to 400 calories per day. So I think that's very important for us to be able to take note of that there are a lot of things we can do at home without even going out.
That's right. Aside from physical health, the social isolation, uncertainty, or even loss of jobs and loved ones brought about by the pandemic has impacted the mental health of many. Dr. Ray, what are things that we can do to protect our mental health during these times?
As family physician, it's very important to stress that our mental health is as important as our physical health. So in maintaining our mental health, we have to keep our body and mind healthy. So we have to talk it out with our friends and relatives if ever we're not feeling good, and we should have a happy disposition because I think getting a strong support system would be very important in this time of pandemic.
And while technology allows us to maintain connections despite social distancing protocols, constant news about COVID-19 can add to your stress as well as your anxiety. Now, following simple safety measures can also help ease your anxiety. We shouldn't forget that COVID-19 can spread wherever you may come into close contact with an infected person, whether it's outdoors or indoors. Now, Dr. Candice, let's remind our viewers again on how does COVID-19 spread?
So, yung COVID-19 spread as respiratory droplet. So, when we are outdoors, when someone sneezes or cough, if you are in close proximity with that person, you can easily contract the virus if you are not wearing protective gears or protective measures like face masks.
Okay, that's very good advice. Speaking of that, Dr. Candice, let's remind our viewers again, hindi tayo nagsasawa dito kung ano yung mga minimum health standards.
Yeah, so yung minimum health standard, number one dyan will be washing of hands. So if you are outside, yung hand sanitizer will be very handy. And also, you should wear mask. So, proper wearing of mask. So, hindi pwedeng nakababa sa ilong. So, dapat cover yung nose and mouth mo. And also, keep a safe distance. So 6 feet away from yung hindi mo kakilala. And also, avoid staying indoors. So if you're going out, better yung in an open space para maganda yung circulation ng air.
We know now that the vaccine rollout is steadily increasing and a lot of people are getting vaccinated. But even after vaccination, we still need to continue with these safety protocols. As our government works on inoculating all Filipinos, keep in mind that immunity doesn't happen right away. Dr. Ray, after vaccination, after that first jab, are you already fully protected with what that vaccine is intended to do for you?
After getting vaccinated, hindi ibig sabihin na nakabuild ka na ng immunity. So, it takes some time for the body to build an immunity. So, studies would show na it will take around 2 weeks para makabuild ka ng some protection to the vaccine on your first dose. But at a certain point in time, your protection might increase and then over a period, bababa ulit siya. That's the reason why we need for another booster dose or your second dose of your vaccine.
So after your first dose, a good immune response kicks in after around 2 weeks. But it's really the second dose that fully boosts your immune response. Unfortunately, the IATF reported that more than 1 million Filipinos have missed their second jab. Dr. Ray, what happens if you opt not to get the second dose?
Of course, kapag hindi mo nakuha yung second dose, you will not be fully protected against COVID-19. At syempre, yung efficacy ng vaccine na isa, compared kapag nakuha mo yung dalawa, would be lower. So it's very important that you complete the doses of your vaccine.
So even if you're vaccinated, others may not be. Follow health precautions to keep them safe from COVID-19 infection. Now, Dr. Candice, please explain, why does one need to continue with precautions even after vaccination?
We have to continue because we don't know yet the effects. So all the vaccines are experimental at this point. Although it has protection, we still have to protect ourselves because not all Filipinos are vaccinated. So there is still risk of spreading the virus even though you are vaccinated.
Now, Dr. Candice, some vaccines have been approved to be given to children, but some not yet. What's a good advice for the parents who are still unsure on whether to give the vaccines to their kids or not?
For those younger ones na wala pang recommended na COVID vaccines, it's important that they complete yung mga recommended vaccines for their age group. For example, yung mga measles, yung mga pneumonia vaccine, flu vaccine. So even these vaccines are not for COVID, it's very important that children are being updated with their recommended vaccines.
Yes, very good advice. Now, we should all do our part to protect each other. We'll discuss safe and best hygiene practices after a short break. Stay with us here on MedTalk Health Talk, your partner in healthcare. This is CNN Philippines. Today, we're talking about health and safety protocols to keep you and your loved ones safe amid the pandemic. I'm Dr. Freddy Gomez. Welcome back to MedTalk Health Talk on CNN Philippines. One of the unforeseen challenges the pandemic has brought about is the effect of disposable face masks on our environment. According to estimates by Greenpeace Taiwan, from early February to mid-May, Taiwan produced and used around 1.3 billion surgical masks. That's 5,500 metric tons of general waste in a span of 3 months. While you may think this might not have an effect on you, it affects everyone. A clean environment can actually improve your health as well as your well-being. And although we can't do away with masks, one of the best hygiene practices today include disposing of them properly. Dr. Candice, can you tell us more about this? Give us your suggestions on when to use a cloth mask and when is it okay to use hospital-grade face masks?
Okay, so for the hospital grade, usually you use it kapag you are dealing with COVID-19 patients. So and also for those patients with respiratory illnesses para to prevent you from contracting the virus. But if you are just going out or not going in a hospital or in a high-risk setting, yung regular face mask is just the recommended mask to use. For children, usually if less than 2 years old, we don't advise them to wear masks, no? So these are high-risk population. So better to just keep them at home.
Okay, so that's good advice also on how old is it safe to wear face masks. And also remember, after disposing your face mask, don't forget to wash your hands with soap and water. As life starts to slowly return to normal, there are also best practices to keep you safe when stepping out of your homes, dining out, and even returning from home. Now, Dr. Ray, what are some of the things we need to remember whenever we're out and about?
It's very important na kung wala namang reason, valid reason para lumabas, then we have to avoid going out. But if it's unavoidable, then it's important pa rin po to wear your face mask. And then, of course, as what Doc Candice mentioned kanina, kailangan pa rin nung sanitizer or alcohol. And then, of course, you have to be careful and you have to be cautious of what you're touching, especially with surfaces, no? So yun yung mga important things that you have to remember when going out. And as much as possible, you also distance yourself, 6 feet pa rin yung layo mo, and avoid large crowds and those places na hindi maganda yung ventilation.
And as much as possible, don't touch your eyes, your nose, mouth, or your mask's surface. Always remember that. Now, Dr. Ray, marami sa mga restaurants ngayon ang nag-accept ng mga customers, which is a good thing for our economy. But what should our viewers know whenever they decide to eat outside?
Ang pinaka-consideration mo when you would want to go out and dine out is that you should have a place na open area or well-ventilated. Pero kung hindi maiiwasan in an enclosed area, you have to distance yourself. Again, proper physical distancing. And at the same time, you only remove your mask when you're gonna eat. Pero as I made mention, it's very important to be cautious. So mas maganda pa rin na paghanap ng place where there's open air or well ventilation so that you could ensure your safety and your other family members.
Yes, very good. Now, Dr. Candice, how about the families who go out? Marami sa mga pamilya ngayon ang nagbabakasyon, trying to get whatever's left of summer, and they bring their kids along. So what should they be mindful about whenever they have their kids with them when it comes to being safe?
Very important yon yung safety protocols natin. So they should follow that even though they're going out with their family. So very important. We cannot overemphasize yung washing of hands. So we teach our kids to do that, and also yung wearing masks. So above 2 years old, and also keeping a safe distance. When they are out, make sure that better kasi kung yung kids parang hindi talaga lumalabas, no? But yung kung lalabas sila, better na open space talaga. So some would go to beach na wala masyadong tao. So I think they will be more safe there.
Okay. Pero Dr. Candice, when it comes to COVID-19 in general, what is the latest information now on its risk towards children as opposed to that of adults?
Before, konti lang. So, konti lang yung kids na nagkakaroon. But now, there have been reports of increasing cases in children. So, mas mataas pa rin with adults. So, higher risk for the adults of having COVID-19. And also, yung severity, mas severe with adults as compared with children. Usually in children, when they have it, usually mild lang, yung iba parang asymptomatic. We still want to prevent our child of having the virus. So, we keep them safe usually at home.
Now, whenever you step out of your homes, remember to wash your hands frequently with soap and water and for at least 20 seconds. Or if you don't have access to soap and water, sanitize your hands. Although rare, COVID-19 can also be transmitted through touching surfaces, then touching your nose or your mouth or even your eyes. Another best practice includes thoroughly cleaning these high-touch surfaces in your homes as well as your offices. We'll discuss this after a short break. We want to be your partner for a lifetime of good health. You're watching CNN Philippines. This is MedTalk Health Talk, where your healthcare comes first. I'm Dr. Freddy Gomez. When it comes to COVID-19, we want to take every precaution necessary. Cleaning and disinfecting high-touch surfaces in your homes and offices regularly can help lower the risk of infection. But Dr. Candice, first of all, ano ba itong mga high-touch surfaces or high-touch areas na ito?
So yung high-touch areas will be yung mga like yung doorknobs, yung tabletops, yung phone natin, yan, yung mga high-touch. So yung mga lagi nating hinahawakan o yung mga dirty areas, so yun yung mga high-touch surfaces.
Okay, so high-touch areas are indeed the spaces in your homes and offices we are constantly touching without even thinking about it. Like what was mentioned, your phone, your keyboards, or even especially your doorknobs. Dr. Ray, can you walk us through how best to clean these surfaces? Kailangan bang mga high-tech cleaning agents ang gagamitin dito?
May mga DIY naman po na pwede nating gamitin sa mga bahay natin like bleaching solution or chlorine kung available po. So for example, if you're using a bleaching solution na with 5% chlorine, so you can have 100 ml of that, add up lang ng 900 ml of water, and that you could use for cleaning up your surfaces po, no?
While some people say vinegar and other natural products can help clean these surfaces, it's actually not recommended. So it's best to use disinfectant solutions. But please always read the directions to make sure that you're using the product as recommended and to avoid damaging your items and hurting yourself as well. Dr. Candice, what should you do if, let's say for example, may chemical solution that gets splashed into your eyes? Anong magandang first aid para dito?
So first aid talaga is to wash it with running water. So yun talagang first aid, to wash off the chemicals. And then if you feel like burning sensation or irritability, after you have done the first aid, it's best to go and see a doctor.
Yes, always go see a doctor if you're unsure of the current condition of your body. Now, moving on, while it's currently unclear how long the virus can survive on fabric, sometimes clothes have plastic or even metal elements where the virus can survive. So it's vital to practice cleaning your clothes even after a day's work. Dr. Ray, how should we go about cleaning clothes when returning home?
When you're returning home, it's very important for you to protect your family. Kaya nga, kung as much as possible, you have some disinfection bin where you could place your clothes, especially yung mga nagamit nyo sa workplace, so that it will not be added up to kung ano yung usual na nasa bahay. And then the usual, pwedeng painitan muna siya or pwedeng isegregate muna for a while para at least hindi siya masama dun sa usual na mga damit ng other members of the family.
Okay, now from clothes, we want to talk about handling food naman. While there is no evidence that COVID-19 can be transmitted through food, it's still possible to contract the virus when touching a surface or a food package for that matter. Dr. Candice, can you give us some tips on handling food safely?
Yeah, so pag-handle ng food, especially mga deliveries, no? So once we have received them, we should wash our hands. And also when we have taken out our food, again, wash your hands. So very important talaga yung pag-wash ng hands, no? And then you can also heat yung food that you have prepared.
Now, whether dining out or at home, always use clean utensils and plates. Dispose of the packaging properly. And again, wash your hands frequently. We can't stress that enough. These safe and best practices can help protect your physical and mental health and of those you love. Thank you to our guest pediatrician, Dr. Candice Brillante Corpus, and family physician, Dr. Ray Christopher Ubiña. We appreciate your insights on the show very much. I'm Dr. Freddy Gomez. We'll see you again next time. Stay safe, everyone.